the testimony you're about to give in this action, show the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
Amen. And Doctor, if you please state your full name and spell it for the record.
First name is Stephanie, Stephanie. Last name is Yagi, Yagi.
Thank you. Ma'am, what do you do for a living?
I'm a medical examiner at the Clark County Coroner's Office.
And how long have you been so employed?
About 3 years.
What is it that you do on a day-to-day basis at the medical examiner's office?
So my role, my primary role at the medical examiner's office is going to be determining cause and manner of death in any sudden, unexpected, violent, or suspicious deaths.
How do you go about examining a deceased person that comes into your office?
So to determine cause and manner of death, oftentimes we will do a medical type of examination, and one of which is an autopsy.
Are you trained in conducting autopsies?
Yes.
Can you please describe your education and training in order to do what you do?
As a medical examiner, I am a medical doctor. I have my degree and I'm licensed to practice medicine in the state of Nevada. I am also board certified in anatomic, clinical, and forensic pathology.
And if you didn't say already, how long have you been conducting autopsies with the Clark County Coroner's Office?
About 3 years.
You mentioned the terms cause and manner of death.
Yes.
What is a cause of death?
So a cause of death is going to be a natural disease or traumatic injury that ultimately leads to cessation of life.
Do you conduct autopsies to determine cause on every single death within Clark County?
No.
Which do you focus on when it comes to autopsy specifically?
So our office, again, is responsible for conducting medical examinations on any sudden, unexpected, violent, or suspicious thereof deaths.
Can you give a couple of examples of causes of death?
Sure. So causes of death might be something like hypertensive cardiovascular disease, which is high blood pressure, blunt force injuries due to motor vehicle accident, something like gunshot wounds.
Is there a difference between a cause of death for your purposes and the mechanism of death?
Yes.
Can you describe that for the jury?
So the mechanism of death is more what's happening inside your body, so the pathophysiology of our particular disease process or traumatic injury, where a cause of death is going to be the overarching event that led to death.
You also mentioned the term manner of death. What does that mean?
Manner of death is how the circumstances of the death arose. It's a categorical determination of which we have 5. So those are going to be a natural, accident, suicide, homicide, or undetermined.
When it comes to homicide, what does that term mean?
For us, homicide is death at the hands of another.
And what does the undetermined manner mean?
Undetermined is for situations where we can't make a determination. So it is either unknown or we can't determine between one or more other mechanisms or manners of death.
We'll get back to that in a moment. In your prior testimony, you mentioned the term autopsy, and I think I glossed over it. What does an autopsy actually entail?
So an autopsy is a medical type of examination. It has multiple parts. The first of which is going to be an external examination. So we look at the body. We document any identifying features, eye color, hair color, tattoos, any external trauma or injuries that we can see with our eye. Then we'll move on to an internal examination where we open the body in a surgical-like fashion. We again inspect the internal organs for things like natural disease or trauma and injury. The autopsy also includes ancillary testing such as like toxicology testing. We can do imaging like x-rays. We can get other consultations as we see fit, as well as look at tissue under the microscope if needed.
And I would presume that every autopsy is a bit different and determinative of what types of testing you're going to conduct.
Yes, so we perform these things on a case-by-case basis.
I want to bring your attention back to August 8th of 2023. On that date, did you receive a body ultimately identified as Johnathan Willette.
Yes.
And was that your work documented under Clark County Coroner's Office case number 23-04811?
Yes.
What was the condition of John's body and how did you receive it?
So the body is received at our office in a sealed body bag. Once the seal is broken, the body undergoes forensic processing and goes through the autopsy procedure as I've previously discussed. At the time of the external examination that I performed, there was absence of the head of Mr. Willette's body.
While the autopsy process is occurring, are you or other staff photographing the body?
Yes, photographs are taken at every step of the process of the autopsy examination, which are done by our forensic technicians.
Those forensic technicians, do they go hands-on with the body at any point during the process?
Yes, our forensic technicians are actually responsible for moving the body and eviscerating the body, which is, again, doing the internal examination or internal dissection portion of the exam.
Do those forensic technicians work in tandem? Do they work alone? What is the common process?
The forensic processing is usually done by the forensic technician in singularity prior to the exam, and during the exam, we do work in tandem with the forensic technician.
Weird question, but I have to ask it. What percentage of your forensic techs are female?
Currently, at this time, 100% of our forensic technicians are female.
And is it common for those female forensic technicians to flip bodies on their own?
Yes,
All the time?
quite often.
In this particular case, you and forensic techs documented the process of the autopsy and have moved for the admission of 464 through 494, Judge.
Any objection to those?
No, Your Honor.
They'll be admitted.
Thank you. May I publish?
Yes.
Starting with 464, what are we looking at here?
So this is a photograph of Mr. Willette as received in the body bag.
465, is that his lower body?
Yes.
What are these items on his hands?
These are bags to preserve possible trace evidence that are placed on the body at the scene.
During this process, do you measure the body?
I personally do not, but the body is measured, yes.
And when I say you, I sometimes mean the team. Somebody in the process measures the body, correct?
Yes.
In this particular case, what were the body's measurements?
The length was measured at 68 inches and the weight 169 pounds.
So his body as received is 169 pounds, correct?
Correct.
I would presume it would be more if his head was attached.
Yes.
Do you know the average weight of a human head?
Probably on the line around 10 pounds.
Okay. During your external examination of the body, what general things did you notice?
So, as previously stated, there was the absence of the head and upper neck, as well as there were some changes to the front side of the body that were consistent with some kind of chemical type burns.
Okay. Back to 464. If you could point to what you mean by chemical type burns.
So all along the front of Mr. Willette's body, we have changes of the skin, which again are consistent with a more chemical type burn.
Are all of the changes or the discoloration in the skin we're seeing those chemical burns, or is there something else going on here?
There is additional to the burn type pattern. There's almost like a diamond weave type pattern that you can see on predominantly the chest, which is actually consistent with the pattern that was seen on the mattress where Mr. Willette's body was found.
Okay. Ma'am, what is lividity?
Lividity is the postmortem pooling of blood in the gravity-dependent areas of the body.
And what is slippage?
Slippage is a term that we use for the appearance that the skin can show when there's separation of the top layer of skin that happens.
Okay. Does that typically happen post-mortem?
Yes.
Showing you the front of John's right arm. Do you see that there?
Yes.
What are we looking at here?
So this looks like to be an area of some postmortem changes, which could be, as previously described, some area of skin slippage.
When it comes to lividity and these postmortem changes that occur to a body, is it possible for you to establish a time of death based upon that?
Sometimes.
Okay, what do you mean by that?
So there are a lot of factors that we need to evaluate for determining time of death. Most of these factors are highly variable, which includes things like the actual decedent's natural state of health. In addition to that, the environment that the body is found, things like heat, humidity, et cetera, as well as any external factors or the environment, such as water or air or soil that the body is found in.
Not to mention, you're typically not conducting an autopsy immediately after death, correct?
Correct.
In this case, I believe you did it on August 8th.
Yes, that is correct.
Okay. And so, do you have an opinion as to John's time of death?
No, our determination on time of death is, again, highly variable, and it would have to be given within a range of time based on the state of the body. In this particular case, it would probably be within a half day or hours.
States 472. Oops. Is this John now laying on what would be his belly?
Yes.
Is there an anatomical or, I guess, a forensic term for that?
Prone?
So he is prone with belly down now, correct?
Yes.
What is this kind of discoloration we're seeing on the side?
This could potentially be an area of liver.
What's liver?
As we previously discussed, blood pooling in the gravity-dependent areas of the body.
What does this tell you about John and his circumstances of his death?
At one point in time, he may have been face down or face up. This is a lateral aspect of the body, so I can't tell you.
Okay. Showing you 473. What are we looking at here?
This is kind of the neck region of the body.
From the back?
Yes.
474, same position basically?
Yes.
Now with a ruler? Did you or your forensic techs clean up John's body?
Yes, the forensic technicians.
Before I move on, did you notice anything about the blood that was abnormal? Is this normal? The coloring?
I can't tell anything from this photograph.
475. What are we looking at here?
So this is now a cleaned up photograph of that same area, the neck region from the back.
Is there anything notable to the back of the neck?
Yes.
What is that?
So in this photograph, you can see that there are some superficial incised wounds that are somewhat parallel to the main area of defect at the neck here.
476, is that a little bit closer on those areas that you were describing?
Yes.
What does this tell you, if anything, as a forensic pathologist?
This may indicate there were previous attempts to use a sharp force injury in this area.
Previous to the decapitation itself?
Yes.
Did you document John's hands?
Yes.
478, is that his right hand?
Yes.
479, another angle of his right hand.
Yes.
480, same thing, another angle.
Yes.
481, inside of John's right hand.
Yes.
Did you observe any bleeding injuries to his right hand?
No.
482, is this John's left hand?
Yes.
483, also his left hand?
Yes.
Do you see these little things here?
Yes.
What do these appear to be to you?
Some type of callus or blister.
Any bleeding injuries to his left hand?
No.
484, another shot of his left hand.
Correct.
485, the inside of his left hand.
Yes.
And what are we looking at here?
Again, I would consider these blisters or calluses.
Any bleeding injuries to his left hand at all?
No.
Did you observe any minor injuries to the rest of John's body, staying away from the head and neck?
Yes, there are a few contusions or bruises to the extremities.
When you say a few, how many do you mean?
At least 3.
Were those minor in nature, meaning not very apparent?
Yes.
I'm going to show you now another kind of graphic photo. 466. Can you reorient us?
Yes, so again, this is a photograph of the neck region, and now the body is on its backside.
Okay. Can you just describe what you're seeing in this photograph?
Sure. So there is a kind of irregular defect that has resulted in a complete decapitation of the body.
When you say irregular defect, can you provide any further context to that?
The surface of the wound looks kind of ragged. It doesn't look straight.
Okay. 468, are we now looking down into essentially what would be John's neck?
Yes.
What did you observe during your internal examination of this portion of the body?
So on the internal examination, anatomically or just by looking at it, this wound did not appear to be ante-mortem. It appeared to be post-mortem, so made after death.
Okay. And how are you able to determine that?
So when the body is alive, there are some features that we can look at anatomically or with our eye, as well as microscopically, to indicate that there was a body's response to an injury. And I saw neither of those, again, grossly or microscopically in this particular case.
So, to oversimplify it, the decapitation happened after he was killed.
Yes.
470, is this a side view of that same area?
Yes.
What type of surfaces or types of the body are actually sliced through when a decapitation occurs?
So in this particular case, we would consider this a complete decapitation. So there is transection through the soft tissues, which are like skin and muscle, as well as any vasculature that is within that soft tissue. In this case as well, the decapitation went through the spine. So both the bony parts of the spine as well as the spinal cord, as well as the structures in the neck. So again, the muscle, soft tissues of the neck, as well as kind of the throat area.
States 486, what are we looking at here?
So this is an internal photograph of that same area, taken from the front side of the body.
What is the purpose of you eviscerating the skin and taking these photographs?
Well, as part of the autopsy examination, we examine all parts of the body, one of which is routinely the neck. So we would do this naturally in every case.
Did you see any evidence of strangulation with what was left of the neck?
No.
What would you expect to see in the event of strangulation?
So in some strangulation cases, findings that are suggestive of that would be intramuscular hemorrhage of the anterior neck muscles, as well as sometimes we can have fracture of the hyoid bone, which is a bone in the neck.
And is the hyoid bone in this particular case gone?
Yes.
So you weren't able to examine the hyoid bone, but you didn't see any of that hemorrhaging you just described?
Correct.
When it comes to eviscerating a body, is it common for you to use tools?
Yes.
Do you use mechanized tools or just hand-powered tools?
Both.
When you use mechanized tools, do you get blood splatter in your face?
Not me personally, no.
Okay. Are there times in which there will be splatter?
Yes.
How so?
So if a saw is being used and there is active bleeding, say within the brain or within the head, sometimes as part of the technique of taking off the skull cap, blood could splatter.
When there's active bleeding inside the head?
Yes.
Okay. If someone is dead, how is there active bleeding inside the head?
Well, there is blood within the cranial cavity, and the sheer mechanism of the saw can splatter blood.
Got it. When it comes to the autopsy process, is there ever a time in which you need to decapitate a body?
No.
Okay, so that's not a thing that you actually would have to do.
No.
And so, in this particular case, did you use tools to take some items out of John's body to forward on to someone else?
Yes, tools were used.
What type of body parts are you removing?
So as part of this particular examination, segments of the cervical spine were removed for a forensic anthropology consultation.
Okay. States 488, is that one of the sections?
Yes.
And
Did you say 488 or 48?
488.
488, okay.
And 489, is that the same section? Was it one section you took or multiple?
Multiple cervical vertebrae were taken out.
States 490, are those the cervical vertebrae that were taken?
Yes.
And 491, what is this little piece here?
I don't know.
Okay. Was this obviously removed from the body
Yes.
and provided to the forensic anthropologist?
Yes.
Is that Dr. Jennifer Burns?
Yes.
Why is it that you need to enlist the assistance of Dr. Burns?
So a forensic anthropologist can help us. Well, she can look at the bones that were removed from the body and possibly do studies, either by eye or with the use of microscope, to see what kind of marks were left on those bones.
And that was done in this case?
Yes.
Once that is done, do you receive her report back?
Yes.
And after that, is it that coupled with a bunch of other stuff that you make your ultimate cause and manner determination?
Correct.
And you mentioned toxicology earlier, 492, what is this?
No, this is a urine drug screen cup.
493,
Same thing, just different side.
494, same thing.
Yes.
Did you send those items out for testing as well?
Yes, we sent multiple samples for official toxicological analysis.
And what were the results associated with John's tox analysis?
So in the peripheral blood, ethanol or alcohol was detected, as well as caffeine and I believe cotinine, which is a metabolite of nicotine. Those items were also detected in the urine and gastric contents.
Was there a low level of marijuana?
Oh, yes. I apologize.
That's okay.
Delta-9 THC, which is the active ingredient in marijuana, and its metabolites were also detected in the peripheral blood.
And was there findings associated with GHB?
Yes. So in addition, in the heart blood, GHB, which is gamma butyric acid, was also detected at a low level.
What kind of scientific explanation is there for the GHB?
So GHB is a chemical that can be endogenously produced, which means our body naturally produces it. And at the level that was detected through the toxicology report is consistent with natural levels of GHB.
Okay, so we all have GHB in our bodies?
Yes.
So the level found here is not as though he ingested some drug. It's actually consistent with naturally occurring levels in our body.
Yes.
And you mentioned alcohol was found in his body.
Yes.
What was the level with association to that?
In the peripheral blood, I believe it was 29 milligrams per deciliter.
And does that, I guess, is there a percentage or a decimal that's associated with that?
Yeah, so that would equate to like a blood alcohol level of 0.029.
And are you familiar with the legal limit in Nevada?
Yes,
What is it?
0.08.
Okay, and that's considered legally drunk?
I guess so.
Okay. Well, 0.02 is a relatively low level.
It's below the legal driving limit, yes.
Are there Are there post-mortem changes that occur that could affect the level of blood alcohol concentration?
Yes, there could be.
And how would that potentially affect the level?
So as the body decomposes, the microbes that are in our body actually also produce alcohol. So in advanced decomposition cases, there could actually be alcohol detected that wasn't necessarily in the body at the time of death, or could falsely elevate the level that is detected.
Okay, so I don't want to oversimplify it, but at the time of John's death, he had a blood alcohol concentration of 0.02 or less.
Yes,
It wouldn't be higher.
correct.
Got it. Ultimately, did you make a determination as to John's cause of death?
Yes,
And what was that?
homicidal violence.
What does that mean in your world?
So it's a term that we use in forensics to indicate that there is no anatomic cause of death that is identified at exam. There's no toxicological cause of death that is identified. And the circumstances surrounding the death are objectively suspicious. So in this case, there is a postmortem decapitation.
Had a blunt force injury to his head killed John, is it fair to say that you would need his head to make that legal determination?
Yes,
That you never received his head up until today's date?
correct. There was no head available for evaluation.
And ultimately, what did you determine was John's manner of death?
Homicide?
Thank you. I'll pass the witness.
Ross?
Yes, was Your Honor going to take, or were we going to take it?
No, we're going to finish her up for lunch.
Okay. Good afternoon. Ma'am, in reference to your testimony concerning lividity, start with that, the beginning of your testimony. Just walk through this. You're not able to give any opinion as to the position that this body was in when this person was decapitated, correct?
Correct.
Can't say if the body's been moved or anything like that based upon your review of the body.
Correct.
You're unable to say whether the body was face down or face up when the decapitation occurred. Fair to say?
Correct.
In reference to the wounds that you had testified concerning, you had said that they may indicate a pre-attempt to decapitate. Do you recall that?
Previous.
Okay, a previous.
Yes.
Could have been a post, though. I mean, you can't say for sure one way or the other, correct?
Correct.
So that's an assumption.
Yes.
At this point in time, on August 8th, when you conducted this examination, approximately how many autopsies did you perform?
At that time, I would estimate maybe 500-600 autopsies.
Okay. How many years had you been conducting autopsies when you conducted this autopsy?
In 2023, 2 years.
2 years. However, due to these, perhaps can we say out of the ordinary circumstances, this was sent to a Dr. Burns. There were tissue samples and things sent to Dr. Burns. Fair to say, the anthropologist?
The bones were sent, yes.
Yes, bones were. You had testified that you were unable to approximate the time of death, other than half a day, something like that, correct?
Yes, a large range of time.
Large rate, okay. So you couldn't say 2 o'clock, 3 o'clock the previous day, could you?
That's correct.
When the body is examined and further dismembered, the body is refrigerated, correct?
Yes.
At what temperature is the body when you examine it? Just give or take.
At the time of examination, room temperature.
Okay, but previous to the examination.
While refrigerated? Or-
Yes. When it's brought. Why don't we go through the process
Sure.
a little bit? The body is brought to the coroner's office, correct?
Yes.
Where is it placed?
The body is then placed in our refrigeration area. Yes.
Okay. And this refrigeration area, kind of like you see in the movies, has bodies, trays, things like that?
Yes, there are other bodies.
And what temperature are those refrigeration units where the bodies are stored?
I don't know off the top of my head.
Okay. Cold enough to preserve the bodies, correct?
Yes.
Fair to say just above freezing?
I can't say.
Okay, you don't know.
I don't know.
You were asked questions concerning through the course of your examinations, these autopsies, limbs, other things are severed, correct?
Sorry, can you
They
repeat the
can be.
question?
I mean, you were asked on direct. At times, there's a necessity to cut a body, correct?
Yes.
And these cuts are generally made by yourself, the coroner.
No, not always.
Who are they made by?
So our forensic technicians assist us in the evisceration portion of our examinations.
And during this evisceration portion, the bodies have just been brought from the refrigerators or the cooling, freezing devices, correct?
Yes, in our storage area.
Fair to say then you're not going to have cast off or splatter because the blood contained within the cadaver is very cold, correct?
Well, the heart is also not beating, so we don't have spurting blood.
We're not talking, we'll get to that. But as far as, obviously you'll agree with me that there's a congealing mechanism when the body is refrigerated, correct?
Blood can clot, yes.
And this evisceration of the body occurs sometime after the death, generally, correct?
Yes.
It can be perhaps like a day, in this case, 2 days, 3 days, multiple days, correct?
Correct.
So we've got a body now that has obviously been dead for some period of time in conjunction with this element of refrigeration, correct?
Yes.
And you would agree with me then, and when the tools are used, and you'll agree with me that these tools that are used are designed to cut through tissue, bone, things of that nature.
Yes.
So they're made to sever limbs or sever necks, things like that, correct?
Yes.
So when you're using these specialized instruments made for the dismemberment of a body, it's done with a special instrument. It's done when the body's been refrigerated. It's been done sometime after the person has been deceased, correct?
In my experience, yes.
Let's turn our attention to the facts and circumstances of this case, okay?
Okay.
Let's say a person is decapitated a fairly short time after that person or upon that person being killed, okay? You'd expect that if the neck is severed or the body is severed from the head, there's going to be fresh blood, correct? Perhaps if the person is dead and the heart's not beating, but we have liquid blood, correct?
I would expect there to be blood, yes.
Let's say a sawzalls are used or some other electric saw. Fair to assume that we're going to have some blood if this head is being severed, correct?
Possibly.
Closer in time to death, the more likely that we're going to have blood that's able to be cast off, correct?
Possibly.
And we're not talking about a slight possibility, we're talking about a real possibility, aren't we?
Can you be more specific? I don't know what you're asking. Sorry.
Okay, what part of my question is unclear, just so I can ask you questions so we can be on the same page.
Yeah, the specification of real possibility, I don't
Okay,
know.
you say it's possible. I mean, it's likely, correct?
Depending on circumstances, yes.
Okay, so now we're getting from a near possibility to a likelihood. This person is dead. This person is immediately decapitated with a non-specialized device. Likely we're going to have some cast off of blood, aren't we?
I wouldn't say yes to cast off. There likely is blood, yes.
And when we talk about likely blood, we're talking about basically the kinetic energy from a saw going back and forth. We're going to expect to see blood spatter, aren't we?
Possibly.
Likely, correct?
I have no experience in this particular situation,
Okay.
so I can't give my opinion as to that.
So when you're asked questions concerning when you're doing this in the very controlled circumstances of an autopsy, you can't really compare, so you can't really give an opinion, but obviously it's more likely there's blood that's going to be spit out or sent out if a person's being decapitated close in time to their death, correct?
Possibly.
Okay. You would agree with me that you can't say to any degree of medical certainty that this person was actually dead when this decapitation occurred, correct?
In my opinion, this decapitation was a postmortem event. So, yes, after death.
Okay. How close in time then? Do you know?
I do not know.
Today you've just testified that it's homicidal. Basically, the death was homicidal in nature, correct?
Yes.
I believe your term was homicidal violence,
Yes.
but you can't tell us how this person died, correct?
That is correct.
There had been questions concerning, is it the hyboid?
Yes, hyoid bone.
And that would indicate perhaps a strangulation, correct?
Yes.
However, in this case, you didn't have that bone to review, correct?
That is correct.
I mean, you can't say if this person died choking, correct?
Can you specify the nature of the choking?
Choked.
No.
You can't say then that could have happened, correct? That's possible.
That's possible, yes.
This person could have had a pillow placed over his face, correct?
Correct.
And then decapitated, isn't that right?
Correct.
This person could have been shot in the head, correct?
That is correct.
So you can't give an opinion excluding that, can you?
That's correct.
You were asked questions concerning any bleeding injuries on the body, correct?
Yes.
Fair to say at this point in time, this body wasn't bleeding, correct?
No active bleeding, correct.
I mean, the head's off, it's not bleeding, correct?
Yes.
Fair to say, and you'll agree with me that, I mean, a decapitation is a fairly rare event in your line of work, as opposed to other manners of death, or
Yes.
would you agree with me that it would be difficult to effectuate a decapitation?
I don't know. I have never attempted one myself.
Okay. Based upon the physicality of this, I mean, there's a number of things that are involved, correct?
Yes.
We have the blood system, the veins, things of that nature in the neck, correct?
Yes.
And you would agree with me that that person is dead or not. I mean, we have the aorta veins? Big veins, correct?
The aorta is not in the neck.
I'm sorry, the heart, but I mean the neck. We have the
Carotids.
carotid, that's a fair amount of blood there, correct?
Yeah, can be.
Dead or not, correct?
Well, if they're dead, there's no blood in the carotids.
Okay, so they're saying, let's say that person died shortly before or at the time of decapitation, there's going to be blood in your carotid arteries, correct?
There might be.
Okay. And if those carotid arteries are severed, we're going to expect cast off from the blood contained within the carotid arteries, correct?
If the person is dead, no.
Okay, so let me say, in the arteries, is there going to be blood? And we're not talking a person that's been dead for days. We're talking minutes, perhaps.
Yes, there may be some residual blood.
Okay, and this residual blood, if those arteries are cut with a power tool, we're going to expect there's going to be some form of cast-off, correct?
There may be, yes.
The musculature, obviously that would have to be severed, correct?
Yes.
And there's a fair amount of musculature in the human neck, correct?
Yes.
Fair to say that the neck contains a fairly complex arrangement of tissues, major blood vessels, trachea, things of that nature, correct?
Yes.
The vertebrae in this case were severed,
Yes.
as well as the thick ligaments connecting such, correct?
Yes.
We also have the spinal column that would have to have been severed, correct?
Yes.
And again, that's fairly a lot, isn't it? I mean, we're talking about a big cut, aren't we?
Yes.
Dense ligaments, cartilage, correct? All that had to have been severed, correct?
Yes.
So this is fairly different than, let's say, a limb, correct?
That depends.
Okay. An arm. I mean, next, a lot more going on there than an arm, correct?
Yes and no. There are still some of the same elements that you see in the neck and arm, including bones and soft tissues.
Okay. But would you agree with me that the neck is a more complex portion of the body than the arm?
Yes.
Obviously, you have the heart supplying the brain with blood, correct?
Yes.
So you have large artery supplying the brain with blood, correct?
Yes.
In your report concerning the postmortem examination of the body of Johnathan Willette, you arrive at a conclusion that it was consistent with the use of 2 tools.
That was not my opinion personally. That was integrated from the forensic anthropologist consultation report.
Okay. But this was the report, and I'm referring to the autopsy report. You authored this report.
Correct, but I garnered that information from Dr. Burns's report.
Do you adopt it? Do you have any reason to disagree with Dr. Burns's analysis?
No.
So then in your report where you incorporated Dr. Burns's conclusions, 2 tools, correct?
Per her report, yes.
A hand-powered knife, correct?
I don't recall if the wording was knife.
And if I told you it says a hand-powered knife, would you have any reason to disagree
No.
with me? And a mechanically powered saw, correct?
Sure.
On your pathologic findings, in addition to the decapitation, you also found hepatic steatosis,
Correct.
and that is?
Fatty liver disease.
Okay. You were given, asked questions concerning the blood alcohol content, correct?
Yes.
And it's your testimony that that was the blood alcohol content at the time of death?
Most likely, yes.
Would that blood alcohol content changed following the time of death?
It could. So as previously discussed in the postmortem interval, there is postmortem development or formation of ethanol that can be produced by the body's microbes.
So then it would be unfair to say what the blood alcohol content was actually at the time of death. Fair to say?
Correct.
And also that person's blood alcohol content would have to be, you say at the time of death, but then we don't know what the time of death is, do we?
Not exactly.
We can't say it was 3 o'clock, 3:30, anything like that, can we?
No.
Now, it's possible, based upon your understanding the physiology of how we process alcohol in our bodies, this person may have had a much higher blood alcohol content, let's say at 1 p.m., correct?
Can you specify the time that you're using in relation to the question?
Okay. You were asked a question, this person's blood alcohol, 0.02 something, remember that?
Yes.
0.29 milliliters per liter of blood. You gave it an opinion concerning the blood alcohol, correct?
Correct.
But you'd have to know the time of death, correct? That's part of this analysis.
No.
Okay. My question to you now is, let's say the time of death is 3 o'clock, okay? are you able to give us with an estimation? And I won't hold you to it specifically, but can you give us an estimation of that person's blood alcohol at 2 o'clock, assuming that person died at 3?
No.
Can you give us the blood alcohol content at 1 o'clock, assuming that person died at 3?
No.
Midnight, you can't, can you?
No.
In addition to the alcohol that was in the blood, you also found evidence of THC, correct?
Correct.
And what was the level of THC in Mr. Willette's body?
I don't recall off the top of my head.
Okay. Fair to say that the combination of both alcohol and THC affects a person's ability to drive a vehicle?
Possibly.
Possibly.
I'm not a clinical toxicologist. My patient population is very specific, and those patients have no clinical signs and symptoms at the time that I see them. So I cannot opine as to their behavior living with those certain levels.
Very, very fair to say. So I'll ask you a more general question. You'll agree with me that the combination of alcohol and THC cause a person to be more intoxicated?
I don't know.
And then thirdly, you had testified concerning the presence of GHB, correct?
Yes.
And you opined that that may be a result just of natural antecedents. Fair to say?
Yes, it's consistent with the level that we would naturally produce in our body.
But you can't give an opinion as to whether or not this person had ingested drugs or GHB specifically.
That's correct.
So this person may have, in addition to ingesting alcohol and marijuana, this person may have ingested GHB, correct?
Yes, possibly.
And again, the combination of these three substances would presumably lead to an intoxicated state.
It might. Again, I'm not a clinical practitioner.
I could have the court's indulgence. Fine, brief question. Through the course of this dismemberment or evisceration, do you wear goggles?
I wear a face shield.
Okay, and that's because of cast-off and things that you may get, correct?
Along with other bodily fluids that we may encounter, yes.
Apron on, correct?
Yes,
For the same reason, to protect yourself from cast-off of blood or other bodily fluids.
correct.
And again, the height of this autopsy table, what is the height?
I don't know off the top of my head.
Is it made for the ease of moving a cadaver?
Yes, so it can be moved up and down.
To ease in the flipping back and forth and such of the body, correct?
Also to help with our technicians who are of varying heights. So they're the ones doing the evisceration, so we want everyone to be ergonomic and comfortable.
Understood, and to work together as a team to move the body, correct?
Yes, sometimes we do.
Thank you. I have no further questions.
No, Your Honor, thanks.
Ladies and gentlemen, do you have any questions for this witness? Okay, seeing no response, doctor, you are excused. Thank you very much for your testimony here today. All right, ladies and gentlemen, we're going to take our lunch recess. It's going to be a shorter than normal lunch recess because we are going to adjourn today at 3 o'clock. So I'm going to shorten the lunch a little bit and then you get to go home early. You're welcome. During this recess, you must not discuss or communicate with anyone, including fellow jurors, in any way regarding this case or its merits, either by voice, phone, email, text, internet, or other means of communication or social media. You must not read, watch, listen to news or media accounts or commentary about the case. You must not do any research such as consult the dictionary, using the internet, or using reference materials. You must not make an investigation, test the theory of the case, recreate an aspect of the case, or in any other way investigate or learn about the case on your own. You must not form or express any opinion regarding this case or the facts submitted to you. Ladies and gentlemen, 12:30 will be in recess till 1:15.
All rise for the jury.
guys have a matter outside of prison?
No, Your Honor.
No, Your Honor.
Okay, we'll be back at 1:15, sounds good?
1:15, yeah.
1:15, okay, we're back at 1:15, if you understand, you were shopping at 3.
Yeah, we have a Dr. Burns coming up.